We are live.
Awesome. Cool.
Everyone, welcome to Monica Campana Health and Wellness Connection. Today, we have a wonderful guest. Her name is Erika Fredenburg, and she has a very, very interesting background. She was a nurse, and now she's helping people and nurses in various ways. Erika, I want to know everything about you. So tell us about yourself, your background, what you're doing, and the floor is yours. Thank you for
Yeah.
being here.
No, thank you so much for having me. I'm super excited to be here and just talk about, what I do and kind of spread the word about coaching and how it can really help you. So a little bit about me and my background. Like you said, I am a nurse. I've been a nurse for 8 years, and all of that time was spent in Houston, Texas. So I worked in a trauma unit down there, and I'm originally from Ohio. I'm actually now back in Ohio. But I'm working down there, as a nurse. It's a lot, especially when you're in trauma. You see a lot. It's stressful. There's a lot of emotions. There's a lot of physical work, mental work. And, I started just feeling stressed constantly. Would have anxiety, was often bringing work home, which a lot of us do. And, working long hours, I was just exhausted. So I reached this point of, kind of almost this burnout point where I needed something different. I needed a change. And I was presented with an opportunity to stay within the same department. So essentially with my same people who I absolutely love. I loved my coworkers. I loved trauma as much as a lot of work as it is. And so I switched away from bedside and did case management, which is like discharge planning and, trying to get patients out of the hospital to their next stepping stone. And that was great. I did that for about 2 years, but this whole time I was away from my family and my family wanted me back more and more. They never let it go. And I still wanted something different. I had shifted schedules, so I wasn't working weekends anymore, which was nice. I didn't have to hire a dog walker for my dog, who you can see in the back, George. And it allowed me a little bit more, I guess you could say flexibility, but going from 3 to 4 12s a week to five, Monday through Friday was a big change. And it took a long time to get used to because, even though we're working those long hours, we have those days off during the week that when you switch to, a regular 8 to 4, 9 to 5 job, you don't really have. And I was still had a lot of stress, still had a lot of anxiety.
How
But
long? How long did you have this job? How long? How many years?
So I was bedside for about 6 years, and then I had more of a case management away from the bedside job for about 2 years.
So 10
And
years.
yeah, yeah. So I knew I needed something different, and I needed a way. I was looking for ways to help my anxiety, help my stress. And coming from Ohio, from a small Northeast town. We don't know a lot about like holistic health and holistic healing, but I was exposed to it down in Houston. And I have good friends, a really good friend who she's all about it and she knows everything about it. So together we're trying to figure things out. And I started, doing more yoga and doing more meditation and was learning different modalities and different tools on how to care for myself and, care for my body and kind of get my mind and my body connected in a different way to help heal that stress and that anxiety and to have ways to manage that. And together we learned about coaching. So we both went to the Institute for Integrative Nutrition, or IIN, which we all like to call it, a little bit easier to say. And, these different ways started being presented to me and opened up to me. And so that program was about a year. And during this time, I was still working full time and still missing home, and still being bombarded with, when are you coming back? When are you coming back? So, um, I started doing these things and wondering, okay, I'm finishing this program. Who am I going to help and how am I going to help them? And as health coaches, we always start out like, we want to help everybody. We just want people to be healthy. We want to help them do what we did and, teach them ways that they can kind of help get themselves healthier without always, then resorting to kind of fixing the problem and instead of preventing the problem. So, and that's one thing that I strive on is trying to prevent these problems from happening and having ways to manage them before they get to a point where
Really
you
bad. Yeah.
really bad. Yeah. And you can't really handle them anymore. So I started learning all these things. I was like, okay, who am I going to help? I'm going to help everybody. And I started working with my own coaches. And once you start getting into it, you realize, okay, you can't really help everybody. You can, but in order to reach the people that need your assistance and to have an audience, you have to get specific. And that's when I realized I had a little bit of resistance around it. But I'm like, okay, my background is nursing. My background's healthcare. I know what it's like to be stressed. I know what it's like to be anxious. I know what it's like to, have a crappy night's sleep and be exhausted for your next 3 shifts in a row. And, as nurses, we don't always take care of ourselves. We're taught the patient comes first always. And so when we're at work, we're caring for patients, we're caring for our coworkers. And then we come home and we're caring for our families or whoever it may be. And we forget to put ourselves first because everyone else in some way matters more than we do. And I saw that, when I'm at work, caring for the patients, putting off lunch, putting off going to the bathroom, putting off having a drink of water. And then by the end of your shift and by the end of however many days you're working, we often work, 3 or 4 12s or more in a row,
Wow.
depending on where you are. Physicians work, I know some of ours work, a week in a row or, sometimes
Without
they have one day
stopping.
a month. Yeah.
Wow.
Don't stop. So this stress just starts building and building and building to where it's now chronic and we start seeing other health conditions. So I know for me, I was at a point where I was saying heart palpitations and I'm like, what is wrong? So I would go to the doctor and, at one point I was wearing a heart monitor and like a holster and, after the 24 hours of wearing it, he's like, there's nothing really wrong. There's nothing like wrong with your heart. I'm like, okay. But I was having like mini
But you were
panic
not
attacks.
feeling well. Yeah. It's
No, I
amazing how
wasn't.
this industry doesn't have really a training and how to cope with the stress and relaxation. I mean, I was thinking, I mean, massages, people who go
Yeah,
and actually give massages to the nurses. And
that
so
would be
you started, so you jumped and you said, okay, I'm going to go on my own and right? And create this, you found your niche basically.
Yeah. And, I found my niche and I knew this is who I had to help because I knew what it was like to work in the healthcare field and to work those long hours and to not be taking care of yourself. And I understood the toll that it took on your body. So in the midst of the pandemic in June, around June, I had decided, or before this, I had decided to move back home and be closer to my family. Within the last year, my sister had gotten married and I was tired of missing out. So on top of helping people, I also did this, for personal reasons as well. I was tired of missing out with my family and I wanted to be closer and share those experiences and be with my sister, when she does have kids and, be with my mom and dad and my grandma, as they're getting older and be close to them. And I wanted this independence as well. You know, as selfish as it may sound, I didn't want to ask someone if I could have time off to visit my family if I wasn't living close. And, as we know in healthcare and in nursing, we work holidays and which it's just the name of the game, we have to. And it gets, when you don't live close to your family, it's hard, asking for Christmas off to come home, which for us, Christmas is like a big holiday. It's like a 3-4 day event. And, I wanted to be able to do my own thing, make my own money on my own without someone telling me what to do, and to be able to travel and do the things that I enjoy which would also help my stress and my anxiety. Being an entrepreneur and building a business is not easy, but, I took the leap to come home, quit my job, and to do coaching full time. And that hasn't been smooth sailing. There's always bumps in the road, but that's what it is being an entrepreneur. You're always going to have these difficult decisions to make, but I knew that I could help people, and I could help people understand that they could manage their health, especially their stress and their anxiety, and hopefully prevent, that burnout that happens a lot in healthcare. And understand that there are ways that they can take control of their health to help prevent getting to the point where you are thinking there's something really wrong, you have to go to the doctor, or you're run down constantly, your immunity is low, your sleep is not well, and you're waking up more exhausted than when you went to bed. And I knew that I could help people do this. Now, of course, when it comes to chronic stress, like I said, it does have these symptoms that show up as maybe heart conditions or, other physical conditions, mental conditions. And it's always recommended that if you have these conditions, obviously check with your doctor and rule out everything else to make sure that it is,
That it's
it is
not
chronic
something more,
stress.
there is nothing else.
Right. Yeah.
And
It's not
so
something.
you started, you are coaching
Mhm.
nurses.
Yes. So I coach, I work with nurses, and I also work with women in healthcare in general.
Okay.
Because there's a lot, in healthcare, and especially as women in healthcare, as women, we're so used to taking care of everybody else, especially if you have families and
Yeah, it's a
kids.
woman's thing.
Yeah. And it's just a thing, I guess. And which unfortunately it is, but it shouldn't be,
Yeah.
it should be taking care of ourselves and making ourselves a priority should be part of our normal daily routine. And, making sure we're catching these things before it hits the point where you're chronically stressed and you're chronically fatigued and you are just burned out and can't take care of yourselves anymore. And then you're getting sick because your immunity is lower, because you're not sleeping well, because you're not giving your body the rest that it needs, and you're not giving your mind the rest that it needs. And we often, I think, forget that our mind, so like our thoughts and emotions and our, feelings and everything, have a lot to do with, our physical health and how we're reacting to things in the world and how we're taking care of ourselves and how our body's functioning. So that's something that I love to focus on is, being mindful and, working on your mindset to being in this more positive, like beautiful state, and being aware of what's going on in your body and, in your external environment as well.
Now, do
And
you have different techniques that you offer? That you focus also on nutrition, physical activities, mind activities, or how do you organize your teaching or your coaching?
yeah. So in the program that I went to, so they call things primary food and secondary food. And what we focus on is primary food. So primary food is not actual food. It's your relationships, it's your spirituality, it's your finances, it's your career. It's all these different things that if those are out of balance, your nutrition's not going to be in balance. So I do include nutrition in my programs, but I try to help my clients, find more balance in these areas of their life to then allow them to have the energy to be physically active, to eat healthy. Because if something's going on, let's say in your relationship with your significant other or with your kids, if there's all this stress and tension there and it's off balance, you're not going to have the mental capacity and the energy to then go and meal prep for the week or to pick a healthy meal or go out and do an exercise. And I mean, for me, that's true. I know if I'm feeling stressed, if I'm feeling down, if something in my life with, my career or my finances, or if I'm not getting enough sleep, I just don't have the energy to go on a jog outside or, go cook a healthy meal. I'm like, oh, this is just too exhausting. Like,
It's
It's
all
one less thing.
connected. Yeah, it's all
Yeah, it's all
connected.
connected. And so when we're able to work on, things in our life and balancing those, we can then focus on nutrition and physical health. So with my clients, I do a lot on those primary foods. So we take a look at, how do you view yourself? How is your self-confidence? Do you make yourself a priority? And oftentimes we're not. Oftentimes, we have a lot of self-doubt. We have a lot of negative talk going on up here, which is something that I've struggled with, and working on getting our mindset to where we're positively thinking and we're positively talking about ourselves. And oftentimes I'll ask my clients, that we'll talk about, how do you talk to yourself during the day? What's going on up here? And, they tell me something and I ask them, would you tell that to your mom? Would you tell that to your best friend? And oftentimes it's no. But then the next question is, well, why are you
Why are you doing it?
right, right.
It's a habit. Yeah.
It is habit. And I was having a conversation with my coach the other day, and it was about advice that we give other people. And, we were talking like, well, would you give that advice to your clients? And so like, well, yeah. And I'm like, well, why are you not taking your own advice? Or even like having a conversation with your best friend, the advice that you give them is advice that we should be taking and using ourselves. So mindset is a big thing that I work on with my clients. And I definitely encourage and promote meditation, journaling. I know a lot of us, I know for me, journaling was something I hadn't done. And it's, even if it's just like a mind dump, like writing down all of your thoughts, because our thoughts are complicated. I was listening to a podcast the one day and they talked about, if you were doing a complicated math problem, would you do this math problem in your head or would you be writing it down on a piece of paper? And the answer is you'd be writing it down, of course.
Of course.
So with our thoughts, they're very complicated. So why are we trying to figure out what's going on up here in our head? So when we write it down, it puts it in a different perspective. It brings us awareness and it kind of makes them a little less complicated. And if they're irrational, you're able to notice that. You're able to see how irrational your thoughts may be on a piece of paper, because it puts it in that perspective. So I focus on that with them, and, things that are going on in their lives, relationships, if you're having a difficult relationship with your parents or your significant other, we talk about that a lot, and we figure out ways to cultivate a healthier relationship, whether that's having the courage to set boundaries and being comfortable with those boundaries. Boundaries is a big thing, and we oftentimes don't set them with fear of, disappointing someone or letting someone down or being seen as selfish, maybe, when the boundaries are really there to protect ourselves and protect our energy. And there's this quote that I really love. I think I heard in another podcast. So I listen to a lot of podcasts, and I send my clients a lot of podcasts if I think it's going to, resonate with what's going on with them, or if it's going to help them in some way. And she said, there's this notion that we're not supposed to be full of ourselves, but if you're not full of yourself, who are you supposed to be full of?
Yeah, that's a good one.
And it's like, you're right. Like, I am supposed to be full of myself, because you're taking care of yourself, and you're not being that in an obnoxious way. You're doing it in a way that is healthy for you, and in a way that you love yourself. You unconditionally care about yourself and want the best for your well-being,
Yeah,
which then in turn,
so you can give and help others. Otherwise you
right,
can't.
right. And like the saying, we've all heard it, you can't pour from an empty cup. And it's true. If you're exhausted and you're frustrated and you're on edge all the time from constant stress and constant anxiety, that's going to affect your relationships with those around you. We may get resentful, we may get snappy. And, so caring for ourselves and making ourselves a priority not only helps our well-being, but it helps those around us too. And those around us start seeing how we're feeling and how we're acting. And they may say like, oh, what are you doing? Like, tell me about that.
It's true. It's
It
true.
is. It is.
Well, and so where can people, you have some specific, do you have anything special
Yeah.
that you're offering right now? Where can people find you? I think I put all the links there, and I know that they can set up an appointment with you, but in general, how does it work?
Yeah. So something new that I've started, and we just started the 12 days of giveaways in, is my Facebook group. So my Facebook group is called the Self-Care Break Room. So it's a place that's for women in healthcare, and we talk a lot about, self-care tools and ways to manage stress and anxiety. And right now we're starting the 12 days of giveaways. So that's a chance for you to come into the group and win something every day, whether that's a coaching session or a self-care kit or whatever it may be. I have sessions with myself, and I also have sessions with some other coaches that I know. One is an autoimmune and gluten-free coach. One is a fitness coach. And the other one, she specializes in breakups and divorce. So she's a relationship coach.
Wow.
And
And is this a private group? This,
yeah, it's a private group.
okay.
So you have to, when you request to join, you just have to answer the membership questions. And as long as you're a fit for the group, you'll be welcomed in. I wanted to keep it private because my intention for the group is for the women in the group to feel safe and to feel that they can share things that they're struggling with, and to have that safe space. So I'm there as support, as guidance, and to just kind of be someone there to hold your hand or just to be there for you. And it's that really one-on-one kind of space. So that's why I kept it private, so that women could feel comfortable sharing things that
That's
they may
nice.
not want the whole world to see.
That's nice. And this is free that people can
Yeah. Oh, yeah.
join. And then from there, maybe they become, they join your coaching sessions.
Yeah. Yeah.
That's
And it gives
wonderful.
you, yeah. And it gives you a little bit of taste of who I am and how I work. And one thing I'm offering right now is a 90-minute intensive. So this is a session with me. It's a one-on-one, and it's where we really dive in to what is going on in your life, what areas need focus on, and then creating tools that are specific and unique to you that will help you to start managing stress, managing anxiety, and to start making yourself a priority. So that is, I'm offering that right now. It's at 167, so it's for 90 minutes. Eventually my prices probably will start increasing, but I don't want to do that during the holidays. But this is a really great opportunity to have 90 minutes devoted to you, someone who is on the other end, completely there for you, there to support you, there to guide you. And with coaching, it's all about accountability. So it's not me on the other end giving you instructions, step-by-step instructions on what to do for your life, and this is going to fix this and this is going to fix
Mm.
that. We can do that all day. It's kind of like a diet plan. You can get a diet plan, but if you're not going to follow it, it's not going to work. So in coaching, what's the main aspect is accountability. And this is the client doing the work and taking that effort and taking those action steps to improve your life and to start using these tools. I obviously, in the calls and in all of my calls, I have suggestions for you, I have recommendations, and I of course help you create this plan, but I'm not there once the call ends. In my programs, I am available to my clients, but I'm not there every minute of the day. I'm not you. So if you're not going to take the action steps, then
It's not
things
gonna
aren't going to
work.
change.
Yeah.
So that's what it is. Having a coach is having someone, if you're meeting them the next week, you got to tell that person you didn't do it. And I know for me, with my coaches, I'm like, oh crap, if I don't do this by next week, I'm going to have to be honest and tell them I didn't do it. So it makes you get things done. It makes you have someone there who's supportive and guiding you to get these action steps done that are then going to allow you to lead a life that's a little bit more balanced and hopefully a little bit more stress-free. So that's what I hope for my clients, is that they come out of this with ways to manage their stress and manage their anxiety and realize there is another way and a healthier way to, live your life on a daily basis and for the rest of your life. These tactics and these tools
You
and
can
these
use, yeah, you can use it
for the
at
rest of
any
your life.
time.
And
That's
yeah,
wonderful. Wonderful,
Yeah. So,
Erica. Well, listen, I unfortunately, yes, I would talk forever and I would
oh,
listen
I wish we
forever
could.
to you. We passed already the 20
Oh, we
minutes,
did.
but the idea is that this is not the last time. This is the first time of many times, and I want to know more about your progress. And thank you so much for what you're doing, because you're helping people, and you're changing people's lives. So you should be
You.
very proud of yourself,
Thank you.
and keep on. You're on the right path. Once again, thank you for being here, for coming and sharing your amazing experience and teachings. So whoever is
Thank
interested, all the information is going to be right here on the post. Contact Erica, because she's truly inspiring, and she
thank
will
you.
improve your life. So thank you again, and I will see you very soon, Erica. Okay.
Sounds good.
uh,
Thank you so much.
Keep in touch.